Dear Hudson School community, I am deeply frustrated and disappointed with the sudden rise of positive COVID cases in Hudson. The information I have to date indicates that the 42 active cases are mostly isolated and no signs of clusters, meaning that very few cases are actually related to one another. This suggests that many people are not consistently following the practices known to prevent the spread of the virus. Wearing masks when 6 feet distance cannot be observed, keeping social distance at all times, hand hygiene, and staying home when experiencing symptoms related to COVID. This also suggests that many people are engaged in social gatherings and other group events without observing the mitigating practices that prevent the spread of the virus. So why am I frustrated? The public school system is the heart of the community. Nothing replaces the in-person teacher-student interactions, the classroom environment filled with great experiences, and the peer-to-peer interactions. Many of our students, Hudson students, need to be in school in order to access the curriculum, to learn, and to make academic progress. These students need the in-person experience. They need to be in front of our teachers and support staff regularly. Our hybrid learning model, however imperfect, offers these students a 2 or 4 day in-person learning experience, which is critical for their success. We have had 5 positive cases in our schools. Several students and staff needed to be quarantined, follow the contact tracing protocol. The result? We are jeopardizing the academic success of our students when they have to be quarantined, as well as the potential of getting them infected by the virus. This is equally applicable to our staff who have to be quarantined, therefore reducing our workforce and also potentially infecting them. We are now more than 6 months into the pandemic. This is no longer March or April, when we were still trying to understand how the virus spread and how to prevent the virus transmission. Every adult in this community has the social and moral responsibility to protect every member of this community, including our children. Now, why am I disappointed? We spent the entire summer preparing for the reopening of our schools, developing learning models that could be utilized during the pandemic period. Our teachers are working extremely hard to deliver the in-person and remote learning models. It feels that all our efforts are not being valued. It feels that some members of our community are not adhering to the mitigating practices that protect all of us, therefore letting our school community down. We are doing everything in our power to provide the safest environment for our students and staff. We have invested hundreds of thousands of dollars to improve the air quality and for the sanitization of our buildings. Our administrators and staff are working harder than ever under complete new and complex circumstances to ensure that our children are safe while in our schools. We are doing everything in our power to provide the best opportunity for learning for our students. Our main goal is to provide stability and a renewed sense of normalcy for our students while enduring the pandemic. To date, we have no evidence that virus transmission has happened inside our schools. Our protocols for social distancing, mask wearing, and hand hygiene, in conjunction with our level of sanitization, which is more advanced than many school districts, have contributed to this status. We cannot and should not stand alone in this pandemic fight. We need your vigilance, your undivided attention to the standards of living under this pandemic. We need every member of this community to step up and to embrace this fight to keep us all safe and to help us keep operating under the hybrid model until we can resume the full in-person school in the future. Our students are doing a phenomenal job adhering to the school's mitigating practices, and I expect you to do the same. We had several weeks with no positive cases in Hudson. We can do this again, for all of us and for our children. Thank you for listening. Stay healthy.